Welcome to our Insight series on organizational well-being. Our question for this week is, Wellness Big Ten, what are the main program intervention options for pandemic preparedness? Number 28. As we answer the question, what are the main program intervention options for pandemic preparedness, which is one of the Wellness Big Ten, we're going to use the same continuum we've used in the past, whereas the further down the list we get, the more costly the intervention is to implement, the more challenging or difficult it is to implement it, but the effectiveness, long-term behavioral effectiveness, tends to go up as we go down the list. Now, let's start with the first one, which is the issue of being able to look at providing messaging to employees about the importance of reducing all of those modifiable risk factors, we're going to look at those in a moment, for respiratory viral infections in order to prepare for the next pandemic threat. It also helps us prepare for the flu and other kinds of respiratory conditions that we run into on a regular basis. The second item is to distribute to employees educational materials on the basics of good prevention strategies and techniques for limiting infection with those viral agents. The third one is to encourage employees and spouses to select and use a primary care provider that can help them become more healthy in general to reduce a lot of the risk factors, which are common risk factors for the more serious kinds of outcomes from a respiratory infection, and better prepare to avoid the complications from those respiratory viral infections. The next area is to encourage personal wellness and sound self-care practices as a routine expectation for life. We can also take steps to strengthen the cultural norms around good health practices and reduction of pandemic risk factors. We can also have employees search their smartphone app stores for the term pandemic preparedness and examine the apps that come up. You can also have a group of tech-savvy employees select those specific apps around pandemic preparedness. We can also provide the best possible smartphone apps and tools of different kinds to help reduce the risk factors for likely future pandemic agents for both the benefit of the employee as well as their spouse and or family members, and then actively promote their use. The next option is to provide access on the company intranet site to the best software apps and tools that can be used to help employees and family members reduce key pandemic risk factors. And we can also provide a lunch and learn session on pandemic preparedness strategies and techniques for employees, and we can invite spouses as well. And we can provide a series of lunch and learn sessions on pandemic preparedness strategies and techniques and have that over a multi-week period. We can also provide a learning management system module that allows you to have both a quiz and then to link that to your wellness incentive approach. So it's a way of being able to have a single learning management system module to help your employees and family members better prepare for a pandemic threat. We also can provide a group of learning management system modules on pandemic preparedness. Depends on how much detail we want to go into, how much specialization. The next area is to provide an e-health portal with a strong pandemic preparedness capability. The next one is to provide a periodic free consultation opportunity with a provider that's specifically trained in pandemic preparedness. And the next area is to have a multi-week course on pandemic preparedness for employees and their spouses. And we can also, lastly, provide a wellness coach to work with employees and spouses on their pandemic preparedness to reduce both the risk factors that put us at risk to more adverse sequelae or outcomes from the infection itself, and the other side of it is to help us with the strategies to prevent infection to begin with. So those are the major areas of programming intervention options that an employer can use for their employee wellness program. Now, in summary, we have, with the COVID-19 pandemic relatively fresh in all of our memories, it is important that all employers do what they can to reduce the possible disruption and particularly the more serious adverse outcomes of a pandemic infection. And these are due to respiratory disease agents, viral agents primarily, and it is also possible interventions that have prevention strategies. We're going to go over some of those in a moment that allow us to reduce the major risk factors that put us at risk, but also avoid infection and then strengthen our immune system response to any exposure to those infectious agents. So these again are some of the options that you can use in a employer wellness program to better prepare your workforce and reduce the disruption that oftentimes and did occur during the pandemic that we just went through. Now let's look at some more of the pandemic preparedness tips. First of all, the risk factors that for respiratory viral infections that we have to be concerned about from the epidemiology of the COVID-19 pandemic are as follows. Those people with cardiovascular disease, all categories, are at higher risk of an adverse outcome from a respiratory agent. Those that have hypertension, those that have diabetes, all categories. Those whose ages are greater than 65 are at increased risk. Those people with severe obesity, a BMI, body mass index over 40, that's an issue that relates to increased risk of adverse outcomes. All those that have chronic lung disease of all categories, those individuals that have impaired immune system function, those people who have chronic renal disease, all, those that have sickle cell disease of various kinds of severity, who have frequent contact with children, those that have an asthma situation and condition, those that smoke routinely, and finally those that have an allergic rhinitis. And that the items that have an asterisk are the items that are traditional issues of behavioral targets for employee wellness programs. So what we're really dealing with here is reducing the risk factors for respiratory viral infections of all types. Whatever is likely to come as a next pandemic threat will likely be a viral, a respiratory agent. So our strategy is basically to say to people, you need to reduce these risk factors if in fact you want to reduce your risk of an adverse outcome from an infection from a pandemic agent, since the pandemic agent is very likely to be a respiratory viral agent. Now, to help avoid respiratory viral infections, there are a number of things that you can do. First of all, you can wash your hands frequently and correctly, and that's that 20-second minimum where you are washing with soap and you're rubbing all the surfaces of your both hands to be able to clean them appropriately. The next suggestion is don't touch your face. Putting your hands on your face tend to put virus close to your mouth and close to the ability for you to ingest them or absorb them through your eye fluid. So basically keep your hands away from your face. Next one is consider wearing a face mask around acutely ill people. There's a great deal of controversy about whether face masks do any good when we're outside or we're with people that don't have an infectious condition. And the other issue has to do with how effective the mask is in limiting very, very small nanoparticles, which are usually the size of the virus that we end up trying to avoid. Also, if you eat a balanced diet with many plant-based food options, you're more likely to experience a strong immune system because you'll be getting a lot of the trace elements that are in that balanced diet. The next area is to get enough good quality sleep and to have your immune system restored to a high level of functioning through that additional or adequate sleep. The next item is to clean and disinfect surfaces frequently. In a public health sense, which is where my background comes from, fomites are surfaces that convey any kind of biologic agent that then affects us in some fashion. So we want to have clean and disinfected surfaces around us. The next item is to use hand sanitizer after you've had a lot of exposure to other people and contact, shaking of hands or greeting people or handling things that other people handle. Now, the next area is to not share personal items like cups or glasses or plates or forks or spoons that convey and can convey viral agents. The next suggestion for avoiding respiratory viral infections are to use a new glass or cup rather than one that has been used previously and left overnight. That's just to reduce the viral load that our bodies have to deal with. And most of us know that viruses are basically on almost all the surfaces that we encounter on a daily basis. Next area is to handle foods carefully so that we don't expose them to virus, which then can in fact grow. And you want to avoid touching refrigerated or cooked foods and then letting them sit at room temperature for any length of time. That's to protect you against bacterial infection, food poisoning, as well as the issue of respiratory viral protection. The next area is to keep your distance from sneezing or sick individuals. That's where the infection and infectious process is communicable, is infectious, and we want to keep that to a minimum. You also want to cover your own mouth when sneezing or coughing because you may be asymptomatic and you may be spreading the virus that actually can lead to infection of other individuals. Be aware of your own temperature or the presence of a fever. So be a little bit better observer of how you feel when your temperature is elevated so that you can detect it at an early stage in any infectious process. And you want to monitor your pet's health as one of the last items that we essentially encounter here. So your pet's health can actually lead to infection of humans because we sometimes get a cross transfer of viral agents from animals to humans. Now, in summary, there are a lot of different ways that we can reduce our risk to any respiratory pandemic agent. And there are ways that we can reduce our risk to any type of respiratory viral agent. And that can include things like regular flu, RSV, all kinds of different things that we come in contact with. So again, these are some of the issues that you can deal with in reducing your pandemic risk. Now, for more information on this topic, put the following search strings into your web browser: pandemic preparedness for working populations, risk factors for COVID-19 infections, and prevention techniques for respiratory viruses. Next week, we will address the question, what are additional types of behavioral targets that employee wellness programs can address? For more information, please visit and feel free to visit our website at www.chapmaninstitute.com.